Before, we lacked drinking water. One day, a woman came for her baby's delivery. I helped her with the birth, but I had no water, and there was no one to fetch it. I had to bring water from a well outside the health center to be able to take care of her properly before her relatives arrived.
The World Health Organization launched the Wash Fit process to improve water, hygiene, and sanitation services in health establishments. In Mali, the International Water and Sanitation Center, also called IRC WASH, implements the Wash Fit approach in 6 rural maternity and 3 community health centers in the municipalities of Nosambugu, Uolodo, and Tioribugu.
The Wash Fit approach makes it possible to set up teams of community members in health establishments. And that also makes it possible to assess infrastructure needs.
Once Wash Fit teams have identified wash infrastructure needs in health centers, these are prioritized. Then an implementation plan is developed, executed, and monitored. Thus, within the rural maternity of Intila, several wash infrastructures were built by the Wash Fit team without outside help.
They trained us to manage without outside help. We identified what we lacked in our health center. The first thing we did was to buy trash cans and place them in the maternity ward. Also, there were no proper toilets, so we built one. So the matron had a place to burn waste. We dug a pit. Plus, we managed to get cleaning materials, and thanks to that, our environment is sanitized now. Also, since the maternity ward is not fenced, we called on young people to make bricks and build a wall.
It is impossible to talk about Wash Fit in health centers without developing wash infrastructures. Since IRC is an NGO that doesn't build these infrastructures, a partnership was created with World Vision Mali in 2017 to fill this void. Therefore, the Wash Fit teams have been trained to plead their cause at the town hall level of their locality to acquire the infrastructures they lack.
We have 9 new water towers that have emerged during our collaboration with IRC. Even if IRC is not necessarily the water tower's builder, they helped us produce documents requesting the advocacy. We therefore promoted these documents to other partners who agreed to finance these constructions. Some built water towers, while others did manual pumps.
Since there was a severe lack of water in the health center, we had to think of a solution because the center is far from the tap. So, we bought a hose to connect the tap head to the courtyard of the health center.
The Kolokani Referral Health Center is one of IRC's key technology partners. Therefore, to sustain the project's achievements, monitoring and evaluation missions are regularly organized by the Chief Medical Officer of the Kolokani Health District.
The essential link of a health center is water, hygiene, and sanitation. For us, it is not only a question of following up to see what has been done, but also of coaching them so that they can continue to sustain the project's achievements.
After 3 years of implementing the Wash Fit approach by IRC WASH in Mali, important lessons and recommendations have been identified to ensure quality care for the most significant number of people.
The implementation of this project has allowed us to see that the Wash Fit approach can be implemented on a lower scale, that is to say, at the level of rural maternity wards. Therefore, we are appealing to the authorities to consider rural maternities in the health pyramid of Mali.
We very much appreciate this collaboration with IRC. It made it possible to achieve many of our objectives as an organization that aims for the well-being of children. We are in the process of signing agreements to be able to continue this partnership so that it can be open to other partners. We are therefore appealing to other partners involved in the sector, because if we want to achieve the 6th Sustainable Development Goal, we can only come together to work in synergy and complementarity.
For the country director of IRC WASH Mali, all these positive results have been achieved thanks to the tireless efforts of several partners, starting with the donor.
Les mots de remerciement, c'est à l'endroit de tous les partenaires qui nous ont accompagnés.
Our thanks go to all the partners who supported us in implementing this project, especially the Swedish Lottery Foundation funding. Plus, we thank the local authorities, the 3 town halls, the Reference Health Center of Kolokani, the Regional Directorates of Sanitation and Hydraulics, our strategic partner World Vision, and all the communities benefiting from this project. To all of them, we say thank you.
Vision et toutes les communautés bénéficiaires de ce projet, nous les disons merci.
On the side of the project's community partners, even if many results have been obtained, several challenges persist and require the continuity of the activities of IRC WASH Mali, both in their locality and within other vulnerable communities.
Many things have already been done, but we still want to help us achieve other goals. For example, we want to install taps in the 3 rooms of the building to have water in our health center. We would really like this project not to stop only at our village. It would be wonderful if it extended to all the villages of our commune and to all localities of Mali to promote hygiene.